Hi everyone, welcome to my presentation, An Intervention of Moving and Breathing Through Grief. From the Techniques of Grief Therapy, Creative Practices for Counseling the Bereaved. My name's Mary Cheney, and I am a Master of Social Work student at the University of Utah. So, to better understand the purpose of this intervention, we're going to talk a little about what happens in the body during grief. I think one of the best ways to highlight this is to look at the literal meaning of the word grievous, which means it's causing physical pain. So, grief is not only an emotional stress response, but it is also felt physically in the body and really highlights the potency of the mind-body connection. We'll often hear sayings like, our issues live in our tissues. And that is, couldn't be more true. And grief demonstrates that very well. And psychosomatic symptoms from grief can manifest as in a wide range of things, but some of the most commonly reported are I feel a heaviness in my chest, my whole body is tense and stiff, my back has been aching, my jaw is clenched, my breath is shallow, and my stomach hurts when I'm upset. So, all these symptoms can further complicate the grief process, making it more difficult to manage. Some even lead to like serious health problems and exhaustion that affects all areas of life. So we know that stress has a huge impact on the body. So physical and emotional stress from grief stimulates a rise in hormones like cortisol and adrenaline throughout the body, which compromises the immune system and creates inflammation. Stress can also cause insomnia and changes in appetite. So it's even been reported in the weeks and months following bereavement that people are at risk of experiencing acute cardiovascular events, and in some cases, an increased mortality rate up to 41% for this reason. So, moving and breathing through grief is an intervention that addresses clients' physical needs and emotional and physical, but with an emphasis on physical needs. It's a 90-minute closed group that begins with a 15-minute check-in that allows clients to sort of sort of connect and have shared experiences, talk about what's coming up for them, what kind of physical, emotional issues are coming up for them in the grief process. And then it's followed by a 15-minute reading or discussion on a grief-related poem. These poems are usually on mindfulness topics, things like finding equanimity, embracing acceptance, the value of impermanence, things of that nature. And then the 1 hour that's remaining is dedicated to the yoga and breath and movement. Here is a demonstration.
So now that I've already talked a little about what this group entails, I want to demonstrate the breath technique. Normally, this 90-minute group is going to be co-facilitated with a yoga practitioner, somebody who can make adjustments and guide individuals into different yoga poses. And so it's accessible really for anybody, any physical ability. There are plenty of modifications that can be used for gentle yoga poses to make it accessible for people who might have some physical limitations. So that is done by a yoga practitioner of some kind. And because the emphasis is on the movement and breath and really bringing awareness into those somatic physical symptoms and awareness between the mind-body connection during a time of loss. I'm going to demonstrate a breath technique that you will use with the clients. You will ask them to use and guide them to use throughout the 60-minute portion of the movement and breath. And it's called Ujjayi breath. It's a very simple yogic breath. And what it does is it helps create long, slow inhales and long, slow exhales and regulates these these regulate the nervous system and help individuals drop into that rest and digest more physiologically calm, centered place rather than a place of fear, anxiety, or anything that's creating stress, any kind of stress response to a loss. And that breath is going to entail a, a, a constriction in the back of the throat. And so when you're breathing through the nose only, but you're going to make a sound that almost sounds like an ocean wave. It's like it's an audible breath. So it goes. So clients will do that breath. And then I'm going to demonstrate one example of a pose that can be used for restorative yoga in this group, and it's called child's pose. You've probably heard of it before. It's very simple. Um, you're just going to stretch your legs out wide and place your hands out in front of you and then rest down. It stretches your shoulders and it just allows you to feel sort of comforted and relaxed. It opens the diaphragm for deep breathing also. So that's child's pose. And just as an example for what might be used in this intervention. And that's all. Thank you.
Okay, so let's talk a little about some of the benefits that are reported from this type of intervention. Clients will report increased self-esteem, and this is from them doing something nice for themselves, doing something to care for themselves. They also report a feeling of true calmness and going back to a place of peace that they hadn't really experienced in their body since the loss happened. They'll also report a renewed sense of hope in their ability to be present and cope with the intense experience of grief that they're having. And lastly, they'll express, sometimes have an emotional release, like crying, that helps release built up tension in the body. This is a picture of an altar that was created during a grief group that I went to. And this can be added into the practice too if clients feel comfortable bringing something to memorialize their loved one during this practice, just creates a little more intention around the intervention. And that is everything. Thank you all so much for attending, and here's my references.